I'm Stefan Swartling-Petersen. I'm a professor of global transformations for health at Karolinska Institutet. I'm here today with you for session 8 on sustainable health for people and planet. We also have people online. Welcome to you as well. Greetings from Berlin. Sustainable health, as we define it, is a multi-sectoral area for study, research, and practice towards improving health and well-being for all while staying within planetary boundaries. Now, we are not staying within planetary boundaries, and therefore, and especially us in this room and us in high-income countries, we escape the planetary boundaries at the peril of others, vulnerable people in faraway places, and at the peril of coming generations, and whose health and well-being suffer. And maybe their development and chance and shot at development also suffers. So in the World Health Summit session here today, 3 weeks before COP27 in Egypt, we will actually examine the mechanisms between environment and health. We will talk about who suffers, what can be done, and by whom to remedy the situation. And we're talking about mitigation, not making matters worse, but we already know we're living in a changing and changed climate. So we obviously need adaptation as well, which to a scientific meeting and a health meeting comes with scientific and practice challenges. So today, in the next 90 minutes, we will hear from Minister Lemke here, Germany's environment minister. We will listen to a keynote from Andy Haynes, joining us from London online. We will have a policy-oriented panel. Then we will pick your brains in the room and online in a Menti word cloud on the most pressing challenges to solve for industry and academia, because industry and academia will come in the second and last panel to solve all the problems that you have laid out. So that is the plan in short. So, ladies and gentlemen, without further ado, please join me in welcoming Germany's Environment Minister, Steffi Lemke, please.
Yeah, dear Professor Petersen, thank you for the warm welcome and welcome in Berlin here to the World Health Summit. By definition, the World Health Summit mainly addresses health crises like the COVID-19 pandemic. And however, such crises are closely connected to the 3 planetary crises: climate change, biodiversity loss, and pollution. These threaten our natural foundations of life and our health equally. Heatwaves, storms, and floods are becoming more frequent due to the climate crisis. These lead to deaths, injuries, and the spread of pathogens. Threats endangers our food production and access to clean drinking water. The destruction of nature and loss of biodiversity weaken ecosystems as well as important barriers that protect against the occurrence of diseases, as the coronavirus pandemic made very clear in the last years. The World Health Organization estimates that more than 2 million premature deaths each year can be attributed to harmful chemicals in products, waste, and the environment. The right to a clean, healthy, and sustainable environment is now a human right. This was declared by the General Assembly of the United Nations in this summer, and this is a very great news. This means that we must now finally implement our international obligations. The Paris Agreement, the Convention on Biological Diversity, the 2030 Agenda for Sustainable Development. The agenda, for example, strives substantially reduce the number of deaths and illnesses caused by hazardous chemicals and air, water, and soil pollution by 2030. Environmental crises affect all areas of policy, economy, and society. This is why we must tackle them together. The health sector and the environment sector are natural allies in this context. One example is an initiative of WHO committed countries and a civil society consortium of hospitals. At the last climate change conference, they called for reducing the greenhouse gas emissions of the health sector and improving its ability to adapt to climate change. Germany was one of the first signatories. We are now working on concrete solutions with our partners in the World Health Organization's European region. Environmental crises affect all of us, but some are more affected than others. Countries that are hardest hit by climate change, biodiversity loss, or pollution need support. That support can be financial. The Nature for Health Multi-Partner Trust Fund, which is supported by my ministry and leading environmental and health organizations, is one example. We are funding environmental projects in countries at especially high risk of zoonosis. The best way to prevent zoonotic diseases and possible new pandemics is to stop further encroachment on and damage to nature. Of course, support can also take the form of policy instruments and the implementation of common rules. This is why we are currently involved in negotiations in international chemicals and waste management with a view to preventing and counteracting illnesses and deaths due to chemicals. In this area, too, the environment side need active partners from the health sector. The fifth session of the International Conference on Chemicals Management, to be held under German presidency in Bonn in September 2023, is an excellent opportunity for this. I would be very pleased to see as many of you as possible there and to achieve ambitious results with your support. We can give concrete from the strategic alliance of the environment and health sector. Thank you for your attention and have a good day here with good results in the panels. Thank you so much.
Thank you. Thank you, Minister Lemke, for those challenges and a warm welcome to Berlin. Now, from Berlin, I want to go to London and online, where we have Andy Haynes. Sir Andy Haynes, Professor of Environmental Change and Public Health at the London School of Hygiene and Tropical Medicine. Andy, can you please get us up to speed about the linkages now between environment and public health, and whose health is affected and where? Over to you, Andy, please.
Thank you very much. Can you hear me clearly?
Yes, we can.
Great. Well, thanks so much for inviting me to speak. And I'm sorry I can't be with you. I often do come to the World Health Summit. It's always a great event. But what I want to do today is to, quite briefly really, give you an overview of the links between climate change and health. Now, you've already mentioned that we have these planetary boundaries, which we are currently breaching, many of them. And of course, one of the most important is climate. And so what I'll do is to make the case that climate change is affecting health now, will do so in the future, even more, undermining the health of future generations, but also that there are remedies, there are approaches that we can take now to reduce the health impacts of climate change. So the first slide really just emphasizes the fact that already human activities have heated up the planet. And what you can see on the left side is the difference between natural variability on the bottom line and what we're actually seeing, which is the combination of natural and human factors. And of course, the human factors are due to our activities, particularly in high-income countries, emitting carbon dioxide, which you can see on the right side of the slide. And you can see how carbon dioxide has dramatically increased in recent decades as a result of human activities. Carbon dioxide is not the only greenhouse gas. There are others like methane, for example, which is a very powerful, short-lived greenhouse gas, but carbon dioxide stays up in the atmosphere for a very long time, and we don't know how to get it out of the atmosphere at the moment in a very efficient and economic way. So climate change is happening all over the world. It's not a uniform process. Some parts of the world are heating up faster than the others. Land is heating up faster than the oceans. The Arctic, for example, is heating up more rapidly than many other parts of the world. But there's no doubt now that this is what's happening and it's having impact on our health. There's also now no doubt as to where the responsibility lies. And what this slide shows you is how there are inequities in the emissions of greenhouse gases. This is particularly around carbon. And you can see that the top 10%, the highest emitters, of which we are part, many of those of us in the audience are part of those high emitting part of the population. They're responsible for just about half of the individual greenhouse gas emissions, the carbon emissions anyway. And the bottom 50% is responsible for about 12% of world emissions. So you can immediately see there's an issue here of climate justice or injustice, because whilst the whole world is affected, of course, those who will bear the greatest burden are those living in low-income countries who've been least responsible for the impacts of climate change. So how does climate change impact on human health? Well, this slide, this infographic from a paper we wrote a few years ago, tries to summarize a complex situation. And what you can see at the top is that the increasing levels of carbon dioxide and the short-lived climate pollutants like methane, these causing the rising temperature, increasing rising sea levels, of course, extreme weather events, and through a range of demographic, socioeconomic and other environmental factors, these influence the magnitude and the pattern of risks around the world. And you can see that there's a range of exposure pathways, from the obvious and direct ones like heat stress, storms, floods and droughts, air quality from increased wildfires, water quality and quantity, of course, food supply and safety, a very important impact, the effect on vector distribution and ecology, and then on the far right, the social factors that are most difficult to quantify, increasing poverty, effects of probably a violent conflict and forced migration. But these effects are likely to be very important contributors to the overall impact of climate change on health. I won't have time to go into each of these pathways, but I'll mention some of them. It's important to note that climate change is already having an impact. This is taken from the World Weather Attribution Service, which attributes specific climate events to human-induced climate change. So it gives a probability that these events are not due to random fluctuations, but due to human activities. And what you can see that is that the devastating early 2022 heat wave, or heat events in India and Pakistan, was made about 30 times more likely as a result of the climate change that we've already observed. And this is likely to have pervasive effects on labor capacity, the ability of people to work, and also reducing yield of wheat and other important staple crops. And as we know, subsequently, there's been dramatic floods in Pakistan, which have also added to the disease burden and human suffering. And as temperatures increase further, it's likely that such heat waves will become additionally more likely, perhaps 2 to 20 times more likely than they are currently. So we're headed for a very difficult future, certainly unless we take decisive action. And this slide is taken from a paper last year, led by my colleagues Ana Vicedo Cabrera and Antonio Gasparini. And what this paper does is to look at to what extent we can attribute recent heat-related deaths over the last few decades to human-induced climate change. And they used data from 43 countries and estimated that more than a third of the total heat deaths could be attributed to human-induced climate change. So very unlikely to have happened in the absence of climate change. And the map shows you where this data comes from, but you can see that there are big gaps, there are big gray areas, and there's no data for much of Africa and Asia. So this analysis may be an underestimate, and we need to fill in these gaps as a matter of considerable urgency. We also know that heat, as well as having effects on adult health and increasing the death rates, particularly amongst the elderly and vulnerable populations, one group of vulnerable, of course, are pregnant women. And work that we've been doing in West Africa, in the Gambia, led by my colleague Anna Bonnell and her Gambian colleagues here, shown measuring wet bulb globe temperature literally in the field with women subsistence farmers. They have documented that these women subsistence farmers are already exposed to such extreme heat. If they were Olympic athletes, they would be told that they couldn't compete because it was too hazardous. But they are forced to go out and work because they have to provide the food for their families. And we've recently documenting some of the effects this is having on the fetus and on the mother. And we can see at the end of a shift, for example, at the end of a working day, the fetal heart rate goes up, for example, indicating that it's having measurable effects on the fetus. And we know that extreme heat also increases the risk of preterm birth. We also know that there are other direct, fairly direct effects on human health of climate change. One of them is increased wildfire risks, and we're understanding a lot more about these in the last couple of years. There have been a number of papers published. On the right side of this slide, you can see how death rates go up in the 3 days following exposure to wildfire smoke, according to these studies recently published. On the left of the slide, you can see how the wildfire-related PM2.5, that's these very fine particles that get deep into your lungs, how these can cause extraordinarily high levels of PM2.5, over 200 micrograms per cubic meter in some cases around the world. And we believe that wildfire particles are more toxic than ordinary urban pollution because they contain more oxidative components, which are more pro-inflammatory and damage the human body more. But we also know that climate change is affecting a range of infectious diseases and will do so increasingly in the future. And this slide summarizes some of these pathways. It shows you that 3 types of infectious disease can be impacted on: vector-borne diseases, food-borne diseases, waterborne diseases. And you can see how climate change, through a range of different pathways, can affect the pathogen, increase range of particular pathogens, increase viability, disease vectors, mosquitoes, ticks, and animals, and the host, of course, by changing nutrition, causing forced migration, and leading to undernutrition. And this can result in a range of increases in the burden of infectious diseases. We've also already heard reference to the possibility of increases in zoonotic infections, not just due to climate change, but also to land use change, which is one of course, of the drivers, of course, of climate change and biodiversity loss. So this is a paper in the BMJ just a couple of years ago using mathematical models of dengue vectorial capacity for the 2 common dengue vector mosquitoes, Aedes albopictus and Aedes aegypti, led by my colleague Chris Murray at the London School. And this shows you how the vectorial capacity, their ability to transmit dengue, has gone up since 1950, particularly since 1980, as a result of a warming climate, or a heating climate, as I prefer to call it. So it's very likely that some of the increase in dengue that we're seeing around the world is contributed to by climate change. It's not the only factor, of course. Climate change often interacts with others, but it's just one example. But there could be some very nasty surprises ahead, of course, and one of those could be pathogens released from melting permafrost. So as you melt the permafrost, of course, you release those microorganisms that have become trapped in the ice for sometimes millennia, the so-called Methuselah microorganisms, because they've developed these many adaptations to survive in the permafrost. We know that some organisms that are damaging to human health, like Clostridia, for example, smallpox, also toxins like mercury and others, nuclear waste as well, could be released as the permafrost melts. And of course, the permafrost also releases methane, which is a greenhouse gas, and can further accelerate the climate crisis. We also, of course, additionally know that climate is having a big effect on the food system, being amplified, of course, by the Ukraine crisis at the moment, the Ukraine war. But we know that increasingly, as shown on the left side of this slide, from modeling studies, they tend to agree that these impacts on crop yields will be negative from the 2030 onwards. Indeed, they are probably already negative. And they could be more than 10% decreases as we move forward in this century. And you can see on the right side of the slide where the decreases in crop yields will occur, the red bits on the map, and that covers much of the planet. We may see increases in temperate regions, but we don't know whether populations will be able to afford to buy food from those regions where increases in crop yield are occurring, nor how long those increases will occur for. So that means that there's going to be increasing undernutrition in the future unless we take evasive action. And we know that it's not just the crop yields, it's also the nutrient quality of crops. So as we put more carbon dioxide in the atmosphere, we also reduce the micronutrient levels, the zinc and the iron in crops, and that contributes to micronutrient deficiencies. But it's not just physical effects, it's also the mental health effects. And we're becoming more aware of the mental health effects of climate change after extreme events, for example. Depression, anxiety can persist for long periods. This concept of solastalgia, the grief and distress caused by the changing environment, where communities witness these dramatic environmental changes, for example, in the Arctic, where populations are forced to relocate as a result of the melting of the ice. And then climate anxiety being experienced by many people, many young people, of course. And I think this is a very understandable reaction to a hazardous and uncertain future. And as far as we know at the moment, the best antidote to that is climate action, getting involved in doing something about climate change. So there may be a positive spin-off from that as well. So we need to act, as we've already heard from previous speakers, and we need to act in two ways. One is to adapt to the climate change that we cannot prevent because we're already at 1.2 degrees. And sadly, I don't think we're going to reach 1.5 degrees, which is the prime target of the Paris Climate Agreement, very sadly to say that, although we still have to keep struggling, of course, to reach it. And secondly, we have to mitigate, we have to cut emissions, and that's because we still have to increase the ambition for deep cuts in greenhouse gas emissions. So adaptation means better flood protection, better disaster management, upgrading our infrastructure, more resilient healthcare systems, and mitigation means cutting greenhouse gas emissions, particularly in high-emitting countries. The evidence base for some of this is still patchy, particularly around adaptation in low-income countries. You can see the results of a recent systematic review at the bottom of the slide. Only 2 studies of rigorous evaluation of adaptation in low middle-income countries. So we need to invest in proper evaluation, but we need to act now while we're not wait for action, and we need to evaluate while we're acting. This just give you one example of how to adapt. This is taken from a paper last year by Ollie J and colleagues in the Lancet, showing how we could help to reduce the effects of heat on health risks. And you can see that the health sector has an important role to play, but also has to engage other sectors. Integrated surveillance and early warning systems are important, but we also need community response plans, cooling centres for the vulnerable, like the elderly, for example, distribution of potable water, targeting of vulnerable groups, such as those living in informal settlements, refugees, the elderly, and so on. Climate resilient health systems, but we also need reconfiguring our cities for more green space to help cool the cities, more passive cooling in buildings, and of course, more access to cooling strategies by individuals, not just dependence on air conditioning, which is energy hungry, but also passive cooling like cool roofs and shutters and shades and so on. But moving forward to a net zero economy, what do we need to do to reach that 1.5 degree world, which is currently, of course, rapidly slipping from our grasp? This shows you what we need to do and what we're not doing in sufficiently rapid pace and at a sufficiently large scale. We need to stop burning fossil fuels. We need to have net zero buildings from 2020, all the new buildings. We know that we have to stop producing fossil fuel powered cars within a few years. And of course, we have to stop building coal power plants. And all this is not happening at the adequate pace and scale, as I've said. But as we move towards a net zero carbon economy, it's important to note that we can also benefit health in the near term. And this is an important lever for additional change and additional ambition. Because as we cut emissions, we don't just reduce the risk of dangerous climate change, we also, in the near term, benefit human health, for example, from reduced air pollution. When we stop burning fossil fuels, we reduce air pollution, particularly PM 2.5 exposure, which is a major cause of death. And this is a slide taken from a study we did a few years ago, led by Jos Lelyveld from the Max Planck in Mainz. And you can see where the benefits would occur from reduced air pollution on the map. India, Pakistan, China, Indonesia, but also much in Europe here, North America, less so in Latin America and Africa because they don't burn so much fossil fuels. But obviously, if they were to go down the pathway of a fossil fuel economy, they would burn more fossil fuels and therefore they would create more air pollution. So big benefits for human health, both by reducing air pollution deaths, perhaps 3.6 million a year, we estimated, causing increased risk of heart attacks, stroke, lung cancer, diabetes, and other conditions. We also know that there are big benefits from much more sustainable food systems. This is just one study we did a few years ago in the UK, showing that if we could reduce consumption of high greenhouse gas emission foods, particularly animal foods like red meat, for example, to some extent dairy as well, in the UK, by following WHO nutritional guidelines, we could reduce dietary greenhouse gas emissions by about 17% in the UK and increase life expectancy by about 8 months overall, something of that order. And if you go towards more radical dietary change, of course, you can get bigger reductions in greenhouse gas emissions, perhaps 30 or 40%, without necessarily moving to a totally vegetarian diet. So big health benefits, big health benefits. And then cities, of course, many of us live in cities. What can cities do to adapt to and mitigate climate change? Obviously, accessible and efficient public transport is one key issue. Active travel, walking and cycling, because we know probably about 5 million premature deaths a year related to sedentary living. And the best way of getting people active is public transport, walking and cycling, less dependent on the private car. Universal access to clean and low carbon energy. And we're increasingly recognizing also the green space is good for human health, both physical and mental, and can help to cool the urban environment, reduce energy demands. And in many low-income countries, of course, access to water and sanitation is a crucial part of climate change adaptation. Increasing green space and reducing traffic in cities can have, as I've said, increases potential beneficial effects on human health. This is an example of Barcelona. They've developed this concept of superblocks, amalgamating 9 city blocks, preventing through traffic, planting more vegetation, encouraging more walking and cycling. And colleagues in Barcelona have estimated that if they could expand this to the whole city, there could be big benefits from reduced air pollution and improved physical activity. And on the left side of the slide, you can see where there's good evidence of the health benefits of natural spaces. The black lettering shows you where there's good evidence, and the grey lettering shows you where further studies are needed, particularly in the case of child health. So there's emerging evidence, but it's not absolutely definite as yet. So big potential benefits from these kind of urban strategies. And when you add all these benefits together, you get big impacts on human health. This is a nice paper last year by Ian Hamilton and colleagues in Lancet Planetary Health. And they looked at the effects, the public health benefits of reaching the Paris Agreement in 9 countries. And they showed that by 2040, if these countries filed and implemented nationally determined contributions under the Paris Climate Agreement that put health at the center of their new climate policies, they could reduce air pollution deaths by over 1.6 million, diet-related risk factors deaths by over 6 million, and annual deaths attributable to physical inactivity by almost 2.1 million. So these are big benefits to human health from implementing these clean energy and food system strategies as are already required under the Paris Agreement, and there would be big benefits in implementing those commitments. And then finally, we've already heard about the importance of health systems. Now, health systems are responsible for about 4 to 5% of the greenhouse gas emissions on the planet. If they were a country, they'd be the 5th biggest emitter. And we already know that an increasing number of countries are committing themselves to building health systems, which are not just resilient to climate change, is obviously important to withstand climate shocks, but also have a much lower environmental footprint. And there are at least 14 countries which have set a deadline by which they will reach net zero emissions, including the NHS in England. So it's really important that the health system is involved, but we shouldn't stop at the health system. We need to decarbonize the economy more widely, as I've said, and using the health argument to lever rapid change. And remember, in the healthcare system, it's not just decarbonizing the energy supply, it's also the supply chain. Pharmaceuticals, medical equipment, these have big carbon footprints. And so working with the private sector, as we'll hear later, is going to be crucial. And increasingly, we need to procure goods from companies that are prepared to sign up to net zero emission strategies. And I know that's what Nick Watts, leading up the NHS England programme, is planning to do, increasingly procuring goods from those companies. So finally then, in conclusion, we have a limited carbon budget. Those of us in high-income countries have largely spent our budget, sadly. We have probably somewhat less than 400 gigatons, 400 billion tons of CO2 left. And of course, there are others like methane as well. And that means that we have less than 10 years, some people have said even less than 7 years of emissions left. And it also implies that those of us in high-emitting countries need to cut those emissions more rapidly than those in low-income countries. They should have the opportunity to benefit from the limited carbon emissions that we have available to keep within these guardrails for the climate. Even if we want to keep within 2 degrees, which many people think is far too high, we have about 25 years of emissions left, something like that. So we have to act very quickly, and we have to adapt, and we have to mitigate. And the health argument for adaptation and mitigation is going to be a crucial one. And I think that's going to play an increasingly prominent role in the COP27. We'll be looking eagerly to see how health has a more prominent profile in the COP27 discussions in Egypt in just a few weeks' time. But let me leave you with the fact that we are in a climate emergency, that some countries have a bigger responsibility than others. We need to act very quickly, and the health argument for action is really imperative. So colleagues, friends, really all power to the work that many of you are doing to advance climate action in order to protect human health in the years and decades to come. Thank you so much.
Thank you, Andy. That was a tremendous tour de force with a rather depressing but somewhere hopeful content as well. I was trying to keep track of the millions of deaths across your slides, and I got lost. And I realized a birth cohort of the world is 140 million births per year. So between all of those numbers, that's a sizable proportion of deaths, actually, that is going to befall people due to these various reasons. So that leads me to a question, which is only partly joking. You are professor of environmental change and public health. Shouldn't your title be environmental change or public health?
Yeah, well, thanks, Stefan. Yeah, I mean, some years ago, I changed the title of my professorial chair because I realized I was changing direction in my career. I mean, I was brought up as a clinical doctor. That's what I did for many years. I was an academic in primary care and family medicine. And I found myself moving much more towards the environmental change agenda because it seemed to me to be the overwhelming threat to human health. Why is it and public health? Because public health has neglected environmental change, you know. Of course, we've done some work on traditional environmental impacts, air pollution, water, and so on. But we've really neglected global environmental change. And I wanted to give due recognition to what I saw as the growing importance of environmental change as a determinant of human health, both now, but of course, increasingly going forward. And I try to make my work not just sounding the alarm, but also helping to develop and evaluate some of the potential solutions towards a net zero healthy economy.
Thank you, Andy. Have a good rest of the day in London.
Thank you so much.
And then I would like to welcome our first panel here. We have Rose Kubsinje, an activist, environmental health change graduate from Oxford. Please welcome graduate. We have Abu Campo. Abu is the chief of health for UNICEF. He has 2 billion children on his shoulders. And we have Alan Dangour, who is Wellcome Trust Director of Climate and Health. Please, thank you. Rose, you're not just an activist. Let me point out the obvious. You're also a woman, well, that one you can't see, from Uganda, my second home. You are a woman, and you're the incoming generation, somehow. And now you have, how do you see this situation and the challenges from that position? You're the future.
That's quite tricky. And yeah, I mean, being a Ugandan climate activist, and you're talking about health and recognizing that the climate emergency is a public health emergency, and seeing that the most affected people are definitely are not in the summit. And I can't say that they are so representative of their voices. It's a big challenge to put on all those, positions on me. So, but yeah, I recognize the climate emergency as a public health emergency. And with, the malaria in Uganda that is increasing, there's so much fight that has happened already, but the mosquitoes are increasing. I was back home last month, and it was crazy because it's getting warmer and they can breed even more, but also the droughts increasing with the heat stress. And because for us from the global south, who depend a lot on agriculture as our main source of livelihoods and income and food, I think anything that affects our food systems is something that is erasing our life and affecting education. And recently we had floods in Kasese, which is the western part of Uganda, and floods in Mbale in the east. And many people were left displaced, and many people lost their lives. And to me, being here, I shouldn't see it as a privilege, because voices like myself should be here. But unfortunately, young Africans continue seeing these spaces as a privilege. And what is happening right now, there's a lot of youth washing and tokenism, whereby some few 1-2 young Africans are put on a stage, and everyone goes back, they're like, yeah, we've engaged Africans and they're sorted, But yeah, so being here, recognizing that I'm supposed to be here, and being thankful again for the support of Makerere University. Yeah, I think I'm looking forward to the discussion.
Thank you, Rose. That was a very strong opening. Abu Campo, you're chief of health at UNICEF. That's 2 billion children and young people on your shoulders. So what's your take, and from your position and of responsibility and influence?
Well, it is a big responsibility, not just for me, but for the entire organization. I think whenever there's a crisis, in any case, children are bearing the biggest burden, of this particular crisis, whether it's climate-induced, human-induced. We always see that when crises occur, stress level at household levels are increasing, violence against children and against women are basically on the rise. They're the first one who are neglected. We have seen it with the COVID-19 pandemic, for example, you know, school closure is another one, which then basically impaired on the rights of the child. So I think there are many impacts, and the environment is not exempted from that. I mean, the way how we look at the last 5 pandemics, these are basically self-induced reactions, and nature is fighting back. And this is where we have, you know, viruses coming from the animal world, transgressing to the human world, and then affecting everyone else. And if you don't think clearly, I mean, if you don't really think deeply about that, of how we are treating our environment, how we are contributing, you know, to this aggressive trend of health impact, because we are treating or not respecting our environment in such a way, whether it's to increase of pollution, deforestations, you know, bringing the animal world much closer to the human world as well, well, we will be seeing a much bigger impact. I mean, heat waves is killing, you know, 1 in 3 children every year. Lead poisoning is on the rise as well, because you can find lead in, you know, toys, spices, cosmetics, you know, which is basically in every single household. We have vectors. I mean, it was mentioned by Andrew Haynes already. I mean, he has given I mean, he's taken all my talking points here because he has presented everything what I wanted to say. But definitely, you know, you have vectors, you know, who are contributing to the rise of pathologies, and who is affected the most? It will be children at the end of the day. And therefore, you know, we have to have a deep look into how we are behaving, how we are treating our environment, how we take into account, you know, not just pollution, but also waste management to a certain extent. And while we, as UNICEF, really advocating for more safe drinking water, at the same time, we are in a water-constrained environment as well. So it needs to be thoughtfully thought through in terms of water conservation, water management, to really ensure that the future is not more dire than it is already now.
Thank you. And we'll return to discussing this. Alan, you sit on a big bag of money as Director of Climate and Health at the Wellcome Trust, a research and policy influencing organization. What's your take on the situation?
Thank you. Very pleased to be here. So Jeremy Farrar actually sits on a very big bag of money. I sit on a reasonable sized bag of money. So the Wellcome Trust, for those of you that don't know, is a global independent charitable foundation. We were founded in 1936 to support science to solve urgent health issues. And this year we took on 3 major global health challenges, which are mental health, infectious diseases, and climate and health, which is the area that I lead. Wellcome has made an unbelievable commitment, a public commitment to spend £16 billion over the next 10 years to tackle these crises and to continue its world-leading efforts on discovery research. I think we heard from Andy the scale of the problem. It's frightening, it's scary, it's catastrophic. And what we must do is we must drive change. Within Wellcome, we've decided as our mission to put health at the heart of climate action. As Rose says, the climate crisis is a health crisis. And the scale of the impacts are going to be just astonishing. And Andy says that putting health in the center is imperative to our future. And I can't, you know, the evidence he provided it really makes that case very strongly. And yet what happens is we often leave the room and we go and listen to a talk on diabetes or a talk on cancer and we move on. Of course, those are fundamentally important health questions, but the basic question of our future is how we respond to climate change, how we mitigate so that we avoid the worst impacts, and how we adapt. And we've seen from Andy the state of the evidence. So we have a ton of evidence on the benefits for health of rapid carbon mitigation, climate change mitigation, and carbon reduction. The evidence is clear that there are substantial co-benefits to health that are immediate, that will affect all parts of society, and will have extraordinary economic benefits as well in the long term. So the evidence is very strong. We have a call out at the moment for those of you who want to do more research on this topic on health co-benefits of climate change mitigation. You saw, however, on the adaptation side, we know basically nothing about the impacts on health. A systematic review which found 2 studies which ex ante asked the question, what are the impacts of health of this adaptation? So what we really need is a fundamental change in the availability, in the generation of evidence and the availability of that evidence for policy use. So welcome, under my leadership for the Climate and Health Challenge, is asking researchers around the world to generate research not for publication in high-impact journals, not to further their CVs, but rather to generate evidence which is requested by policymakers so that policymakers locally generated as well, co-developed with local policymakers in the countries that are most affected, to generate the evidence that can be used for policy action, putting health evidence at the heart of climate action.
Thank you, Alan. I think that's a tremendous opportunity and also challenge to everyone here at the World Health Summit and beyond, but good enough. I think you're making the challenge in the right place. Now, Rose, speaking of challenges here, you're now sort of an activist, and here's one chief and one director who wield considerable power and influence. So what's your challenge to them now?
Be nice, Ray.
Yeah, in fact, I had thought of a message that is coming from World Health Summit 2030. But I think we'll share that after this with the directors to take up the conversation. But challenging them right now, I think I would really want, especially for us young people from Africa, we want to see that, really appreciate the work of UNICEF that is doing, especially with providing access to clean water for the children. But we'd like to challenge the decision makers and policymakers and people in leadership and big organizations to go beyond greenwashing. There's so much greenwashing happening at the moment. People make commitments to just get hand claps, and when they leave the platforms, the whole everything change. And so we'd like to see a shift from making promises to actual action that is going to transform the most vulnerable. And also challenge of, I know it's hard to tell what is moral, and what is immoral, but that moral obligation and responsibility for historical injustices and historical emissions for the wealthy nations and developed countries to undertake, because as a climate activist, we've been asking for, climate finance for the global south, but we're not seeing it coming through because, and then there's the topic of loss and damage, which is very much in line with today's topic on health. But we don't see that climate finance coming. And for us from the global south, we shouldn't be begging for that money. The wealthy nations should be taking that responsibility and not giving us loans, because we're already overburdened with loans. We're already overburdened with debt. They should be paying, the polluters should be paying for their responsibility. So looking at the UNICEF director, I think there's a bit of progress. I really recognize that. And but we need to go beyond we need to amplify our action and multiply it by 10, I would say, and increase ambition, and more so go beyond just providing handouts to building capacity and ensuring that the people, once you leave, the people will be able to build themselves and build their own resilience and reduce their dependence. For the Wellcome Trust, and as you mentioned, I hope that is what happens in implementation, but I like the approach of shifting from publishing papers in high impact journals to producing actual data that is needed. Though I don't know if there's a disconnect between the policies on paper and the actual implementation, because I see that problem happening a lot especially in the developing countries, whereby you have so much, good policies on paper, but the implementation story is totally different. Yeah. And the other challenge is integrate young people and women, make it mainstream. And I think it's high time women stop feeling like, it's really a privilege to be part of a big panel or to be part of to have a big position. And I feel overpowered sitting between three men. But I'm taking back the power from the audience. So.
Thank you. Power, action, capacity,
Finance.
Good. Those are a good couple of words to take with us, and we'll examine more of them. Now, Abu, you're the chief of health in what is actually a multi-sectoral organization. And let me spill the beans. I actually had Abu's job once. And when you're you're responsible for UNICEF's health strategies, and you have around 1,000 people around the world to give strategies to, who work with governments, etc. But then UNICEF is so much more than health. There is education, there is the water sanitation people, there is social protection. And I think we're talking about the multi-sectoral challenge here. So, Abu, are you better able to leverage your colleagues and make a multi-sectoral response than I was?
You're making it very difficult for me, Stefan. You're right. I think in any instances, I think we have seen that health cannot be just addressed with health solutions. There are other solutions out there. There are different determinants who impact on health as well. One of our greatest executive director, Jim Grant, has understood it very well. Already in the 1980s, he has packaged, he has kept it simple, but he has combined nutrition, education, and WASH into one of the primary healthcare components. So it is possible for us to do so, to achieve certain gains in that sense. I mean, if you want to address the new challenges or health challenges, public health challenges exist around the world, we need to work on water and sanitation. We need to make sure that clean water is available in those communities so that we can bring down the burden of waterborne disease, for example. And it's still unacceptable that in 2022, we have children dying of diarrhea. That's not acceptable. I think, as somebody was saying this morning, I mean, there have been 3 people who went to space just last year or this year, and yet we're having people dying on this globe, for something which is completely preventable. Solutions basically exist. So I think we're bringing, our expertise from the water and sanitation sector. So it's not just bringing safe, clean water, as I said before, but it's also in terms of water management, because we do not want to deplete, our water resources so that in 20 years' time, we have now an issue with water. On the other hand, it's about education. A lot of things has to do with behaviors in a sense. So our community health worker infrastructure around the globe in those communities should be educating people as well of how to, treat the environment, respect the environment, living with the environment, so that they don't contribute or exacerbate the problem as well. But it is a reality that, the poorest countries are now paying the price of the richest countries' misbehaviors a couple of decades before. And we are asking them to behave in the same way as the others, which is a little bit of a burden for them. Those solutions exist around the globe. They are still quite expensive. And we are asking, people to reduce or improve the technology, but make it affordable so that people actually can utilize them. So within UNICEF, we are making advantage of our multi-sectoriality. This is one of our biggest strengths in UNICEF. We're also taking advantage of our presence within the countries, our footprint, of really making sure that we engage with young people like Rose, that they contribute to us and help us in the fight. It is everybody's business. It's not just one agency business. Everybody needs to step up. Everybody needs to play its role. Yes, there are some of them who need to play a bigger role than others, but we can't just sit beside an idol and say it is just UNICEF business, or it's just Rose's business, Abu's business, or Dan's business. Everybody has to contribute and play their part. Otherwise, we will be having very long discussions and very tough times, because nature is what nature is, and they will fight back, and it will have dramatic consequences in health.
Thanks. Now, Alan, the climate crisis is a health crisis or a children's rights crisis, etc. And you're director of climate and health. We're using the shorthand of climate now, but then I have to remind myself daily that there's the biodiversity loss and a number of things. So is that shorthand a problem, and how do you sort of think about it?
Yes, so we are Wellcome Trust is a health funder. And we have done in the past quite a lot of work which covered a wide variety of different outcomes, including biodiversity and other areas. We think our greatest impact is going to be if we focus very squarely on health as the outcome, the primary outcome. And it's challenging enough. It's challenging enough. We've just heard how difficult it is to bring different sectors together. And what we're asking academics to do, and those interested in policy and those interested in influencing, is bring together these areas that have been quite different, quite separated for a long time. So climate change on one side and health on the other, bringing them together is in itself a big challenge. And we feel that our impact can be the greatest if we focus on that. In the early 1900s, there was an evolutionary biologist called Darcy Wentworth Thompson, and he said that the best science, the most exciting innovations occur at the borderlands between disciplines. Those borderlands, those interconnections, those spaces which we typically don't inhabit because they're difficult. And we typically don't inhabit because we like to be an expert in one thing over here. We might listen to those people, but we don't want to engage with them. That's what has to happen now. We have to inhabit those borderlands. We have to bring people together. We have to bring disciplines together. We have to bring institutions together, so that we can answer this fundamental question for our humanity. Wellcome will support transdisciplinary science that is interdisciplinary and recognizing the need to discuss with communities and discuss with policymakers so that it's embedded and it is informed by local knowledge. It's got to be the way forward. And in health, linking health and climate change is, for me, sufficient challenge for now. Where we go in 5 years' time is a different question.
Thanks. Appreciate it. Rose, in conclusion for this panel here, I have this dream about youth being not singular activists, but being organized en masse and finding an accountability mechanism. So you say, Mr. President, you promised this, Director Alan, Chief Abu, you promised this. Show us the action somehow. Do you think my dream is feasible? Can we sort of get climate activism organized on a grand scale and build an accountability mechanism? You represent many votes.
Yes, I think it is already happening. But I also want to mention that it's not fair enough for young people, to leave school and just be on the streets fighting for their future when the old generation is watching and all they can do is just make empty promises. So children, young people should be in class studying, life is already hard enough, the cost of living is really crazy. Most of you have, by the time you were probably like 30 or something, you had homes, but in our generation, it's not possible. We are fighting so many challenges of unemployment, especially for us in the global South, and, health issues. And now there's climate change. I mean, I just feel sometimes my approach to my activism is not most times anger, but sometimes I feel angry because young people shouldn't be on the streets demanding for their future. And well, the decision makers are enclosed in rooms that are not accessible to them, and they're making decisions determining the future of young people, and young people are not in those rooms, they're on the streets. And again, they're making policy decisions that they're not going to implement, but the young people that are not in those rooms are the ones that are going to implement them. So accountability it's a big one, and I think we've been trying to figure out how to do it. Sometimes we are called aggressive, we are pushed out of rooms, and I think yesterday we saw some protests. There were scientists, like science activists and researchers that were protesting outside. And don't ask me if I prefer their approach or not, but I think different approaches, we will need different approaches. We need people on the round tables, we need people on the streets, we need the protesters if we are actually going to achieve the accountability you're talking about.
Thank you. So please join me in thanking this esteemed panel. Thank you so much, Rose, Abu, Alan. Now, ladies and gentlemen, if we can have a slide here. Now we want to hear from you online and in this room, because the next session, we're going to have industry and academia up here to solve the problems that you prioritize now. So I think you've used Menti. Dig out your computer or your phone, go to menti.com, enter the long number code you see at the top there, 65731665, and then we're going to do a word cloud. So you have to be brief. Which challenge do you see is the most pressing for industry and academia to resolve, given that we're in the World Health Summit context here? You'll get 3 votes, up to 3 votes each. So 3 simple words here, and then we will hear in a few minutes here from the next panel how they also handle that industry and academia as they come on. Are we doing okay? You figured out the Menti thing here. Here's the cloud coming and it's moving. Okay. So far we have 4 contributions. And then if you write the same word as someone else, it will become bigger. So don't feel that you have to be original. You can upvote a good suggestion here by typing the same thing in. Oops, here we go. Wow, you're doing fine. Because we heard now the challenge from Rose. We've heard sort of more policy-oriented people here. But now we're going to sort of next welcome on stage here, actually, our second panel, who are sort of science and industry practitioners. So I'd like to welcome to the stage Ariane de Hoek, who is from Bayer Pharmaceuticals. Please, Ariane. I'd like to welcome one of my bosses, Roda Wanyense. She is Dean of the School of Public Health at Makerere, where I'm a professor as well. And then I'm going to welcome my other boss, who is president of Karolinska Institutet, Ole Petter Ottersen. So if you see me behaving in the next session, it's because my two bosses are on stage. Please come and join us as this word cloud here is growing and keeps growing. So thank you. Ariane, you have a very complicated title. What's your title?
Lead access to medicine, community engagement, but basically it's about creating access to medicines in low and middle income countries.
And you are in private sector for Bayer, which is a very big multinational company, right?
Indeed.
So what's your take from your perspective on what we're discussing here?
Well, I have an opening statement and it'll cover some of those. And I'm pleased to say it will also cover some of the points that were coming up here in the Mentimeter: water, for example, collaboration, inequality.
And we'll bring back the Menti-Cloud for our discussion in a bit.
So, I mean, we've seen here in this discussion how human health and planet health are inextricably linked, and they are the backbones of the UN Sustainable Development Goals. And for those of you who were at the opening ceremony last night, you heard Mark Zussman from the Bill and Melinda Gates Foundation say that unfortunately so far we're not on track to reach the Sustainable Development Goals, but I remain hopeful. How are we going to do this? Well, I present just the one view, Bayer, but Bayer stands for Science for a Better Life and has recognized the risks posed by global climate change. It's taking multiple actions through partnerships. So we have the collaboration point there, providing a variety of products that can help the impact of climate change. And it is not an easy task because, of course, health is impacted also by these extreme weather events, the floods, the droughts, the fires. So I just want to throw a few interesting key facts at you. So the UN estimates that 235 million people will need humanitarian assistance due to displacement by armed conflict, natural disasters, and disease outbreaks this year alone, which is an absolute record. And more than 40% of women experiencing displacement understandably want to avoid pregnancies. Women and girls in crisis situations are a uniquely vulnerable population, and high rates of unplanned pregnancy, unsafe abortion, and childbirth complications are magnified in times of crisis. What about water? I saw water up here as well. Did you know that approximately 2.2 billion people do not have access to safe water? And 1 million people die each year from water sanitation, hygiene-related diseases. Water as a resource is scarce, and the availability of water resources is by far one of the most serious global problems. Only 3% of the water on Earth is fresh water, and most of this fresh water is actually frozen in the glaciers and the polar ice caps. So by 2050, 60% of the world population will face water shortages. What about heat? Another topic. The World Health Organization has warned about global temperatures and the frequency and the intensity of heat waves and their effects on health. And not only does exposure to high heat increase the risk of heat exhaustion and heat stroke, but of course it also has a burden on the heart. And finally, what about disease? Let's take neglected tropical diseases as an example. NTDs include a range of vector-borne diseases like Chagas disease, African sleeping sickness, pork tapeworm, and it is essential that we pay attention to these because tropical diseases will increase in areas where they were never seen before. As other areas of the world are facing higher temperatures, more communities are going to be exposed. So at Bayer, we are trying to walk the talk, and partnerships are the key. So just some brief examples. Bayer Pharma's sustainability goal is to help provide 100 million women in low and middle income countries with modern contraception by 2030. And from the humanitarian crisis perspective, the German Red Cross and Bayer have now joined forces to further family planning activities in humanitarian crisis situations. And the objective is to provide a family planning module. So anyone seeking health services in a crisis who wants to have family planning support can now receive that. Regarding water, I'm very pleased to say that we've partnered with Mina Ghuli on the Run Blue campaign. Some of you may be aware of this. Mina is running 200 marathons this year up until the UN Water Conference in March 2023. She's had half of them are completed, and Bayer is right alongside her in this campaign to tackle the water crisis, make the invisible visible, and to bring partners together to make progress with the water crisis. In terms of heat, we're focused on a wide range of therapeutic areas with new treatment approaches for cardiovascular and kidney health. Of course, this becomes all the more important as heat waves increase. And finally, in terms of disease, we are, together with many other pharmaceutical companies, playing an important role in fighting neglected tropical diseases. We support the WHO NTD roadmap, which aims to permanently eliminate 20 NTDs by 2030. Now, all of these are just a few examples, but they are very important initiatives to move the needle forward. And to end, of course, innovation is key to underline sustainable health and people and planet, but we cannot do any of this by ourselves. And I think this is also something that all of us have learned in COVID. We all have a specialty, whether we're in public, whether we're in private, and by bringing our specialty to the table and uniting them, we can have a global impact, especially for those who need it most.
Thanks, Ariane. And we'll return to discuss and look at the word cloud later. But Rhoda, you are training this incoming generation. The sisters and brothers of Rose, they are in your School of Public Health and they are at Makerere University now. So, and then you do research. So what's your take and what can you solve?
Thank you. Thank you, Stefan. So I'll skip the first statements I thought I would make, and they did such a great job linking the climate issues and health. But there are a few areas I would like to add to that. If it's not been heard strongly enough, is that these effects are greatest in the low and middle income countries. And even within the low and middle income countries, the effects are not uniform. The most vulnerable groups are struggling the most. We are just coming out of the COVID pandemic that has exposed a lot of inequities, and we are all talking about inequities. But one of the areas we've totally neglected that exposed the inequities even much earlier, but we just never saw it, was the climate. Perhaps because it didn't affect all of us as much as COVID has done. But this has been there for such a long time, and we have seen the effects grow until this year. It's like every part of the world is struggling because of this. A few months ago, in my own home where I'm born, it was just rain overnight and more than 20 people were dead. And we've just never seen anything like that. I grew up by a riverside. The river doesn't exist anymore in my lifetime. So a lot of these things are there. We can see the effects. We are also struggling with a lot of disease outbreaks. So it's not just theories and models like what we saw from Andy. We now have Ebola in my country. Even as we struggle with, getting out of COVID, we've had anthrax twice in the past year in my country. So it's not just models and theories, it's real. And it's such a big problem. We need to do something. So it's an issue of inequities when we think about the mitigation, but also the adaptation. And also to build on what Alan said, the science that can help us move forward. So we have had a lot of documents, a lot of signatures, and I was actually looking at some of these closer home that my East African community signed a climate change policy by our heads of state in 2009. And in 2011, our ministers of health in WHO Afro also signed a resolution which they called a framework for public health adaptation on climate change. And the intention was to activate the countries to come up with health sector adaptation plans. We don't have one in my country yet. And I know that many countries actually don't have this. How do we actually move forward? So like Rose said, it's the policies, it's the papers. So Alan, you fund the research, we do the policies, and more than 10 years down the road, there's no action. There's no action. So we need to agree on some package that can stimulate that action. And I was wondering, what do we want from here, Stefan? Is it just another talk?
But on that front,
we have so many important people in this room. Can we live with something that can show that the World Health Summit 2022 is not just talk? So I'm just thinking what can move us forward. There are just a few things. For example, we have very limited awareness about these issues among health workers. We need to do something. We can do that very quickly. I was just thinking about my own country. Vulnerability assessment has not actually taken off. Can we just say, Alan, that you're going to fund the vulnerability assessment, not just in my country, but in several countries in Africa. That is the real research for action, not for publication. We don't even have that. So how are we going to develop an evidence-informed plan? So perhaps the Wellcome Trust and maybe some other people in this room, or Bayer, that let's live with a commitment to just support these countries to do vulnerability assessments so that we can be able to inform the plans. The research that we need to make this happen, just being able to track and monitor the populations at risk, doing a mapping of which diseases are changing patterns, the vectors and whatever it is, and what is it we can do, being able to just document these impacts. If you looked carefully at what Anders shared, there was hardly anything from my part of the world. Does it mean we don't have those effects? No. So why don't we also just say, let's document that so that we can add to that evidence and a global action? How will the action at the global level include us when we don't even have the evidence of what's happening to us? Just having that comprehensive surveillance system that brings together all those pieces so that we can track what we are doing, that means a lot. What about the communities and the populations? Rose said they're not in this room. No, they are not, but they're actually doing so much. Do we know what they are doing? What adaptation and innovations are the communities doing, and how can we build on that? Because it's that local knowledge that is, informing their own local adaptations that is feasible and sustainable for them. So how can we not be able to check just what they are doing? How are they surviving? Even just being able to document those local innovations and saying, how can we strengthen them so that we can have more resilient communities out of homegrown solutions is an action we can do. So we can live here with some resolution, and we have just enough brains to develop this action plan, and we have enough people sitting on money here to fund those action plans. So I feel energized. UNICEF, surely we can't just talk. Here we are. We need to live with something, Stefan.
Thanks, Rhoda. That's excellent. So, Ole Petter, Rhoda has thrown the gauntlet, or what is it you say, to you.
Well, I have a very concrete suggestion. I will come back to that, Rhoda, because you're absolutely right. We have to move on. We have to do something concrete out of this meeting with so many participants. But I would like to start on another note. Now, from the vantage point of academia, universities, research, I'm sorry to say, this is a time for humility, self-criticism, but also, and I will get back to that, Rhoda, innovativeness and optimism. These are the four words that I think I will put to the floor. So first of all, humility and self-criticism. I think this session has made it painfully clear to all of us that we live in a world, also in academia, in a world of short-termism. We are focusing unduly on those pressing, yes, often pressing problems that affect the society today. But even in academia, we are not willing to take on the challenges that loom large in the future, but already now, and in particularly for future generations. We have to abandon the short-termism. And in fact, if we think about it, what academia is for, it's to have the long-term perspectives. Rhoda, we agree on this. So I think we have to act, and I think Andy Haynes was very clear. Health is one of the strongest arguments for acting now. I think he used the term imperative. It's an imperative to act. And I have a suggestion, Rhoda. And by the way, we should not only talk about neglected diseases, but neglected countries and neglected continents, because you're absolutely right. And I should, in fact, come up with a classical example. My own university is engaged in quite a lot of projects dealing with prevention of NCDs. And without putting one particular project to the scene here, many of these projects, they have, well, collaborators in Europe, North America, obviously, but Africa is often of a terra incognita, an empty space for many of these preventive research projects. This has to stop. So we should talk not only about neglected diseases, but neglected countries. But how to proceed? I think we have already the recipe for how to move ahead. We have the difficulties that Alan Dangour came up with, how to spend all this money in the Wellcome Trust. We have to help him out on this. We have the quest for interdisciplinarity, but I would add, not only interdisciplinarity, cross-sectorality. We have to have all different sectors on board. So what I suggest is that we follow up this meeting with establishment of a multi-stakeholder platform for climate adaptation and mitigation, embedded in universities, which after all have this system approach that we so badly need. What is good about universities, after all, is that we have the disciplines that are required to look into the entire ecosystem that has to be changed in order to arrive at the goals that we're talking about. So I foresee a multi-stakeholder platform for climate change embedded in the universities, funded by the Wellcome Trust and other financial funds, having also industry on board, not only academia, but industry on board. 50% of those that attend these multi-stakeholder platforms should be from the young generation. Rose, you are invited already. And of course, who should have a very important role to play there? There is only one professor in the world for global transformation for health, and he's sitting over there. In fact, it's his responsibility, I think, that we bring all these different sectors on board.
You see what a difficult time I have.
But just let me add, I said something about also innovativeness, optimism. We can't muster the energy that is required to move ahead unless we have some optimism to base our attempts on or our endeavors on. And there is ample room for optimism and innovativeness. Let's go back to one point in time where we saw how academia, knowledge, research, industry, political decision makers came together to really make a change. When was that? It was the Montreal Protocol. I think it was 1987, where the world came together, after all, to ensure that the depletion of the ozone layer could not really go on because it threatened the entire existence of humanity. 1995, what happened then? 3 researchers got the Nobel Prize for the discovery of how ozone was formed and depleted. It's doable, but we need a multi-stakeholder platform. We need to move ahead, and research must be an essential part of it.
Thank you, Ole Petter. That's great. Now, can we get the word cloud back? Can we have the word cloud on screen, please? Because as I drink your water, Ariane, I wanted you to pick a word from the word cloud and say what you in Bayer are going to do about it. Speaking of commitments here, or any other. So the word cloud has gone missing. Maybe they will find it. Meanwhile, Ariane.
Well, I think one of the things I saw in there was related to family planning and women empowerment. This is something that I would like to talk about. Yeah, women empowerment. There it is. So I mentioned, Bayer, we want to help provide 100 million women with modern contraception in low middle income countries by 2030. And I was really, really pleased to see in Andy Haynes' presentation, the project that they're doing in Gambia, because something that it's out there, but where people have not paid enough attention to, I think, is that that women are especially vulnerable when it comes to climate change, women and girls. And for those of you who were in the session yesterday on sexual and reproductive health, you learned that it's especially the young girls who get pregnant too early who are dying from childbirth, and especially if they're displaced due to floods, fires.
Where does your science department come in?
Well, the science department, it's also about the mapping. It's mapping and figuring out where are the problems, how do we get there, how do we support these girls and women, and who can we work with in order to truly impact them also, especially in climate crisis.
Thank you. Rhoda, I used to teach on your Master of Public Health program, and let me confess, I gave the same lecture every year. Now, what are you going to do to people like me who give the same lecture every year?
They will soon not have enough space, I suppose. But seriously, I think what you're speaking to is a very critical issue. We need to address the education aspect of this, because what we are teaching is not relevant to today and tomorrow, given the challenges that we have. And to fellow academicians here, we need to change. We are part of the problem, but we need to be part of the solution. And I can say that we've started that. In my school, we are actually reviewing our curricula to look into some of these emerging issues. And we've just started a program in environmental health that's integrating climate change courses. And we are hoping that we can come up with a comprehensive agenda that can address some of these missing pieces that can help us to move the policy and practice forward beyond the publication. So this is a journey we are beginning, but it's a journey that requires a lot of support, and for us to be coordinated, because we can't just do those small pieces one at a time. The other issue I would like to say is that perhaps we need to think a bit more comprehensively about a lot of the issues we are moving forward, and not to lose the opportunity, especially from the lessons from COVID.
Good.
One of the key issues, in the interest of time, is the issue of resilience. I see so many people here talking about resilience only in relation to pandemics. We talk about health system resilience and we forget other related systems related to climate change.
Thank you, Rhoda. Now, Ole Petter, I'm going to challenge you back now, because we heard transdisciplinarity and we heard all sorts of multi-stakeholder. That's a recipe for not becoming a professor. So what are you going to do to the incentive system?
Well, you are a professor.
Yeah, I don't know how that happened, actually.
But you're absolutely right. And that's why I started with the word self-criticism and humility, because, the meritocratic system in the universities, it's not really tailor-made for the changes that we have to make now. Because it's exactly as you say, we are digging deeply into our own disciplines. That is what is rewarding us as scientists and paves the way for a CV with many papers in high impact journals. We have to realize, and that was pointed out very clearly previously, that what needs to happen will happen. at the interface between disciplines, but also interface between sectors. So, but you know, there are good things happening. We are moving away from the high impact journal meritocratic system now. So we see a development in the right direction.
Thank you. Members, thank you for joining online and here. Thank you to the panelists and the presenters. I took away that there is hope in action. Health is the best argument. There is mitigation. We have tons of knowledge, but I think there is some room for research and development on actually how to apply that, probably behavioral aspects, systems change aspects. I heard that there are big challenges on multi-sectoral aspects, its governance, but that also there are plainly medical and transdisciplinary challenges in this field to adapt to this world. And I think also politically, we see many countries now, including my own Sweden, which is forming a government today, cutting back on aid, cutting back on international engagement. And I suspect that at COP27, we will be discussing in earnest climate reparations and whether we are supporting these systems transitions. And that's urgent. So this is for you to be activists, scientific activists, and call your politician, sue someone, and join Rose in the street, and let's innovate and change this room.